Well, now that the pandemic is a thing of the past, how can we counter the mental health side effects left over?
We are joined live by Suzanne Grimacy from the Santa Barbara Department of Behavioral Wellness. Suzanne, thanks so much for joining us this evening. What are some of the mental health trends that you have seen since the COVID pandemic, and it upended our lives for sure?
Yeah, the COVID-19 pandemic impacted people's mental health worldwide, especially for those already struggling with mental illness or substance misuse. But some of the trends: increased anxiety and depression for youth and adults, driven by loneliness, economic stress, health concerns. We've seen long-term post-traumatic stress reactions, long-term trauma, especially among frontline providers and workers. We've seen increase in youth mental health challenges with social delays, again, rising anxiety and depression. Telehealth, it's been a good thing for some and not so much for others. And then workplace well-being, we have seen an increase in compassion fatigue and burnout, all kinds of things that have impacted people's well-being.
Suzanne, how did Santa Barbara County Behavioral Health adapt to the needs of the community during the pandemic and now the aftermath of it?
So in the fall of 2021, Behavioral Wellness was able to access ARPA, American Rescue Plan Act funding, to help provide supports for our community. But we wanted to know specifically what our community needs were and what our community felt would help. And so we launched a community mental health needs assessment. We were so fortunate to have almost 5,000 participants within our community respond to that. We learned a lot of things. We learned that 61% felt that their mental health was negatively impacted, a lot of other data. But it also told us what our community wanted. They wanted social connection, opportunities for activities where they could connect with others experiencing the same. They wanted accessible resources, education, stigma reduction. And so with that, we contracted with a number of providers in the community with all kinds of supports and accessible resources, gardening classes, walking groups, mental health education. And we surveyed our participants, and we saw that about 90%, over 90, of those that took place in these activities reported that it improved their mental health and that it improved their overall well-being.
And you're touching on this, the next part of what I'm going to ask. Are you hearing back from people again as time marches on about what mental health strategies have really truly benefited them?
Yeah, so that's what we're hearing back, that connection, having opportunities to connect in a natural environment with people that share the same experiences, having opportunities to talk about mental health, to talk about their experiences personally in their life with a loved one, with themselves, to learn more, to learn how to talk to people about mental illness. All those things have been very strong factors.
I think we all learned a bit more about ourselves throughout the whole process of COVID, didn't we?
You bet we did.
Yeah. Suzanne Grimacy, Santa Barbara County Behavioral Health, talking 5 years since the COVID pandemic. We thank you very much for your time.
Thank you. And thank you for all that you've done for our community in these past years.
I think one of our silver linings is that mental health is no longer just a side conversation. It's a mainstream priority, and that's a very positive shift for our future.
You bet. Suzanne, thank you.
Thank you.